Thank you very much, Dr. Nidoy. Colleagues, you're most welcome. Again, we apologize on behalf of the organizing team for the delay and the glitch, but we appreciate your patience and the resilience. I will proceed as planned. We have a number of our panelists that I'm going to introduce. In the interest of time, I'll introduce one at a time as they speak. But before we do that, our session is about research capacity strengthening in the area of universal health coverage and sustainable development goals. Before I forget, my name is Fred Kitutu. I'm a lecturer at Makerere University, a pharmacist, and also acting dean of the School of Health Sciences. I would say I'm in my mid-career a scholar of research capacity strengthening and also a beneficiary of efforts by TDR. This session was put together by the WHO TDR, and we'll hear a bit more about it from Dr. Edward Imberu. It brings together researchers from different regions and countries in the sub-Saharan Africa who have been supported by the different initiatives of TDR. And the purpose is to share diverse experiences of how capacity strengthening and career development in research on infectious diseases of poverty can happen. The aim is to provide encouragement to those who are in this on this journey through awareness of opportunities, through networking, and for researchers to pursue careers in infectious diseases of poverty. Strengthening capacity for this research will help narrow the gaps and contribute towards achievement of universal health coverage and the sustainable development goal. This session cannot come sooner, given what we've experienced with the ongoing COVID-19 pandemic and the fact that many countries and actors have had to look indoors, inside, within countries for solutions. So with that, I will move on to invite my co-chair to say a few words before we go on to the first session. Dr. Brenda Okech, please, the floor is yours.
Greetings, everybody. It's great to have you on the session, and apologies for the delay. We are so glad to have you. Indeed, training and capacity strengthening are really key, and we are grateful that WHO thought of this very important session. And it's a pleasure really for us to chair this session, and we look forward to great discussions. Feel free to engage. My name is Brenda Okech. I'm the director at UVRI-IAVI. And as the chair said, I'm one of actually the beneficiaries. And I will wear a second hat and also give a presentation on behalf of Wilfred Mutombo, who is in the field but has shared his presentation. So it's a pleasure, and I look forward to worthwhile engagements. Welcome, everyone.
Thank you very much, Dr. Okech, for those kind remarks. I'm going to reiterate, we have a panel of Dr. Brenda Okech, Dr. Teresa Eduardo, Dr. Edward Imberu, and Dr. Jerry Dr. Jerry. I hope I've not missed anyone else. So all our speakers did not make it. For purposes of moving forward, Teresa was the first to join me. I'll therefore invite Teresa to go first. Dr. Teresa Eduardo Machai serves as the head of the training unit in Manhika Health Research in Mozambique, a satellite regional training center supported by TDR. Her topic of presentation today is organizational challenges for the development and dissemination of training tools for implementation research. Dr. Teresa, like they say in Mozambique, obrigado. Thank you for coming. The floor is yours. Please take us through your presentation. Dr. Teresa. Eduarda, please unmute yourself in case you're speaking.
Okay, thank you so much. Good morning, everyone. And thank you for this opportunity. May I start sharing the slide?
Please go ahead.
Yes, okay, thank you.
Dr. Teresa, is everything okay?
Can you see my screen?
Yes, please. Yes, please. You can change it to a screen slide. Excellent.
I just want to hide this. Okay. Okay, thank you so much once again. I will be, as said in the beginning, I work as a training director at Manisa Health Research Center. I am in charge of all research training activities. So I will be talking about organizational challenge for the development and dissemination of training tools for implementation research. So those are the contents of my presentation. I'm gonna give a brief general overview and concepts, then collaboration, giving an information regarding the research training programs at Manisa Health Research Center, where I'm working, and share some challenges. So in terms of general overview and concept, universal health coverage means that all people have access to the health service they need, where they need them. It means that it includes the range of essentials, health promotion, prevention, treatment, rehabilitation, and also to deliver this service requires adequate and competent health and care workers with optimal skills for that. And currently, at least half of the people in the world do not receive the health service they need. The universal health coverage strategies enable everyone to access the service that address the most significant causes of diseases and death, that ensure that the quality of those services is good enough to improve the health of the people who receive them. And achieving universal health coverage is one of the targets the nations of the world set when adopting the Sustainable Development Goals in 2015. It was reaffirmed, this commitment, during the United Nations General Assembly higher level meeting in 2019. So countries that progress towards universal health coverage, they will make progress towards this, and good health allows children, everyone, and people to reduce the poverty and have the well-being, and also be able to develop for the economic of the countries. Having said that, regarding the Sustainable Development Goals, I would like to highlight that those are the collection of 17 interlinked global goals. Those one which was set up by United Nations General Assembly in 2015, and they are intended to be achieved by the year 2030. They're included in the United Nations resolution called. So here we can see the Sustainable Development Goals. They are 17. I will be focused on the third one. So the good health and well-being is one of the 17 Sustainable Development Goals to ensure health lives and promote well-being for all at all ages, and also aims to achieve universal health coverage. The purpose of this is to end preventable death and newborns, infants, and children under 5 years, and epidemics. So why sustainable development goals is so important? The good health is essential for development, sustainable development, and the 2030 agenda. As we know, approximately, the co-host has asked you to start your video. So therefore, to achieve the sustainable target by universal coverage, at least 1 billion more people will need to have access to the essential health service. As mentioned before, the Sustainable Development Goal number 3 aspire to ensure health and well-being for all, including a bold commitment to end epidemics like AIDS, tuberculosis, malaria, and other communicable diseases by 2030. So, and it also aims to achieve universal health coverage and provide access, safe and effective medicine and vaccine for all. Consider the global health pandemic of COVID. There is a need to give significant attention towards the realization of good health and well-being. So on the Sustainable Development Goal number 3, it's supposed that by the end of 2030, we reduce the overall maternity mortality rate to less than 7 deaths per 100,000 live births, and preventable deaths of newborns and children under 5 years, and epidemics such as AIDS, tuberculosis, malaria, and other neglected tropical diseases, as well as reduce premature mortality from non-communicable disease. It's also important to highlight that by 2030, it's supposed to reduce the premature mortality from non-communicable disease, ensure universal access to sexual and reproductive health, as well as achieve universal health coverage, including financial risk protection, access to quality essential health service to access the safe, effective quality. How can countries make progress toward universal health coverage? Many countries are already making progress toward this, although everywhere the COVID-19 pandemic impacted the availability of health systems to provide unreputable health service. This meeting was supposed to take place last year, but due to this pandemic, it was postponed. And today we are having the meeting online, and it's not the same as having this face-to-face. All the countries can take action to move more rapidly towards universal health coverage. So what I would like here to bring for this discussion is I'm going to talk now to show the linkage between universal health coverage, sustainable development goals, and training activities that has been taken into consideration. So there are some challenges that institutions are facing. Most of the collaborations are based on North and South collaboration and North and South and North. Why this happened? This is an interesting question. So there is a lack of confidence on African institutions. There are several issues that mention that these of lack of confidence. Most of the African institutions, they have poor management capacity. Some of them, they have low quality data when it's time to report or even to prepare an article. The data collected is not that much with good quality. And also this lack of confidence really on the fact that low reporting capacity and delivery of the services or product that those institutions are supposed to do. So I would like to share what is going on Manisa Health Research Center, Mozambique, in terms of human capacity. The consolidation and future sustainability of the center is to have people able to lead and manage research center. Mozambique as a country needs this type of skills development for its own progress, especially on health and biomedical research area. Since the creation of the Manisa Health Research Center, training has been as one of the strategic areas. The partnership with training institutions has been key to strengthening the research and technical capacity of the country. At the center, we do have training as part of research, and we also have training with collaboration and partnership with other training institutions. As you can see, in training as part of the research, we do have research training, postgraduate training, internship, training of technical, and sometimes workshops and seminars where people have the opportunity to share, to learn about the work that has been conducted within the country and outside with other institutions. We do have collaboration also with partnership with other training institutions that are implemented with us, the activities that we are taking into consideration. So this training fellowship program, it's one of the oldest program that we do have. This training lasts for at least 4 to 7 years, because for this training program, the people need at least 2 to 3 years being at the center, learn by doing. The person is involved in a research project where this person is going to learn by doing, has opportunity to participate in seminars, in journal clubs, and also conferences at the national or international level. So after 2 years or 3 years of working experience, so the person has the experience to go for master and PhD. And the master and PhD, they can last for 1 to 2 years. The master can last for 2 years, and the PhD, it can last for 2 to 4 years. It depends when the person is going to take the PhD, and then the postgraduate training. So having said that, from now, this moment, we have almost 32 people that are doing their training, research training with us here at Manisa Health Research Center. 16 of them are doing master, PhD, and 16 are doing master. For those PhD, 10 are national people and 6, they come from other countries. And for the master, 16 of them, they are local from here. Here, I'm just bringing some of the courses that people are taking, for example, the master and PhD program. As you can see, the masters, most of the masters that people have been participated are masters on medical microbiology, science of medicine, clinical research, infectious disease, public health, bioinformatics, social anthropologists. And the PhD is mainly people, they are going for public health, international health, epidemiology, medicine and translational health, biomedical science, and medicine. And some of those areas in some research institutes is not because of the areas that are going to answer, for example, for the Sustainable Development Goal or for the universal health coverage. Those are the areas that sometimes they come from the strategic plan of the institution, or because, for example, the people that are leading those institutions don't think that those are the areas that the institution needs those people to have the capacity in order to conduct the research. So these figures here is just to show you how many people, for instance, in the last 5 years, they have been doing there, for example, for the masters. As you can see, most of the people, they are going for the master on clinical research. And then we have people doing masters on infectious disease, public health, and social anthropology. On the PhD, we have more people doing medicine and translational research. And we do have then later people doing international health, biomedical science, and medicine. So having said that, as we can see here, the objective number 3 for the Sustainable Development Goal, what is expected that we reduce the overall mortality rate to less than 7 deaths and the preventive of deaths, reduce the premature mortality from non-communicable diseases, ensure universal access to sexual and reproductive health. And having said that, I'm sorry, I think that there is one slide. After this slide, what I would like to mention is that I have some slides that I can't see, maybe they are hidden. I'm sorry, I will stop sharing and then going again. So you can see all. I think that they are hidden and I didn't see this during my presentation, so they can't appear now on this presentation. Just give me 1 second. I'm so sorry for that. Yes, they were hidden, and I'm so sorry for this. I'm just unhiding the slides because they are only 1 second. Okay. So I will continue from here. Okay. So, can you see my screen? Hello?
Yeah, we
Yes.
can see it. Thanks.
Okay,
Yes,
thank you. I'm so
please,
sorry.
go
I'm so
ahead.
sorry for that. Yes, they were hidden and I didn't check before. I'm very sorry for that. I wanted also to add the TDR role. During all those process of training, Manisa Health Research Center consider and still the TDR role on training has been fundamental for us. The TDR, for example, has the Regional Training Center, which is University of Ghana School of Public Health. But for that, the TDR Regional Training Center was supposed to give training for almost all the regions. But in terms of the, for example, the Portuguese speaking African countries, it was then later on contacted and the Manisa Health Research Center presented the strategy to support the Regional Training Center Ghana. So Manisa Health Research Center is the satellite regional training center supported by TDR. So our role was to provide training for Portuguese speaking African countries like Angola, Cape Verde, Guinea-Bissau, São Tomé, Príncipe, and Mozambique. So what we have done so far, we have been training as trained trainers for the good clinical practices and for good clinical laboratory practices. Since 2016, we have been training in 2016. As you can see, we have been progressing with the GCP and GCP training course. And then in 2020, we started giving some training also to some of the Francophone countries. And also in 2021, we gave training for some of the Anglophone countries. What happened? We have been training to be a satellite training center to help the Portuguese speaking countries in Africa. But due to that capacity building that we have, we were also requested for other consortiums to be able to provide also this kind of training for Francophones and for Anglophone countries. So far, we have been training, for example, PALOP's countries, 977 people. For Anglophone countries, we started to train them this year. We trained already 27 people, and we are going also to continue training those people for this year and the next year. And Francophone countries, we have trained 84 people last year. So for us, this has been fundamental. We have been learning, exchange experience, and now we are leading this training session and we can provide training for other institutions that are going to conduct clinical trials in their own institution. So having said that and going back to the Sustainable Development Goals, just for you to remember again what I have mentioned, those are the Sustainable Development Goals that we are supposed to achieve. Reduce the overall maternity rate, ensure universal health access and reproductive health, achieving universal, including financial risk, so on, so on. So my question is, will we be able to achieve universal health coverage and sustainable development goals with the training that we are conducting? I'm talking about the research training, as I show the areas that people are doing their master, the areas that people are doing their PhD, consider the sustainable development goals. If so, we are working towards to achieve, how are we going to train people for this end? Are we giving the correct training for the people to contribute for those sustainable development goals? How can we be aligned to achieve universal health coverage and also be able to achieve the sustainable development goal by 2030? Other issue that we have been facing as a challenging, for instance, for this before.
Teresa, you have 1 minute to conclude. Thank you.
I'm ending the presentation. Thank you so much. And we're facing, for example, some of the challenges that we're also facing with this kind of training is the language barriers, and also due to the fact that now the training, most of the training are virtual, and it's not easier to make sure that everyone is really following all the training since the beginning until the last minute. So I would like to bring to the discussion whether the African institutions are really giving the appropriate training in order to achieve the universal health coverage and also the sustainable development goals. Thank you so much for this opportunity. I'm ending from here.
Yes, thank you very much, Dr. Teresa. Again, we are going to have about 30 minutes at the end for Q&A. So I request our colleagues and participants, please type your questions in the Q&A or hold them till the time for Q&A. So given that we've lost a bit of time, I just want to reiterate that to the presenters, please keep within your time. And so far we have three presentations to go. We shall have Dr. Brenda Okech presenting and then we shall have Dr. Edward Imberu from TDR giving us the origin of some of these initiatives that we are sharing today. Then we'll have Dr. Brenda presenting on behalf of another panelist who is not able to join. And given that our end time is meant to be at 1:30, we have very little time. So we'll keep our presentations to between 5 to 8 minutes. I'll then take this opportunity to invite Dr. Brenda Okech to present her presentation, and please let her keep within the time. Dr. Brenda, please, the floor is yours. Let me share your slides from here.
Thank you very much indeed. And I'm very grateful to have this opportunity to present. And I was one of the fellows for the Clinical Research and Development Fellowship. And this was way back in 2007. And I was based at GSK in Belgium for 1 year. And this was under TDR sponsorship. Next slide, please. So this is to acknowledge the funders for the organization where I work for now, which is UVRI-IAVI. I'm really privileged that through the connection and training at at TDR, at GSK, in clinical trial development management, I was able to work with different groups working on clinical trials. And after a series of opportunities, it led me to this opportunity at UVRI-IAVI, where I am director of the program. And the mission of this program is really around HIV clinical trial development. And of course, with all the different happenings now, we have also diverged a bit, and we are also looking into other areas, including COVID. Our vision as an organization is to have a healthy and productive world without HIV. Next slide, please. That's a picture of our organization. So we work in these main thematic areas. Clinical trials is the mainstay. It's the central department that we have here. And we have had the opportunity to work on phase 1 trials, phase 2 trials, and now we are doing a phase 3. So we are happy about the development over the years. We also do epidemiological research in key areas, HIV, TB, malaria, and hepatitis. We have a social sciences department, basic research, as well as advocacy and community engagement. Next slide, please. Of course, one of the key advantages of the TDR training was also connection with various other collaborators. And this has been very key. Of course, as an institution, we have local collaborators, including Ministry of Health, Mildmay Uganda, the Government Institute, Uganda Virus Research Institute, and we also have international ones. And many of these are through connections with collaborators outside the country. And these have been really key in terms of training, because, for example, we have staff who are working with these collaborators either on their PhDs or on their masters. Next slide, please. So the institution has a well-developed clinical trials department. As I mentioned, we are able to carry out trials from phase 1 right up to phase 3. And so far, we've carried out 7 HIV vaccine trials. Our staff are well trained in GCP, GCLP, HSP, And actually, we have also gone ahead to provide this service or this training to other institutions. And Teresa, who spoke earlier, is one of the institutions. Manisa is where we were able to go and also provide some training. But also locally, we have provided this training to Mildmay. So we are very proud of that, of passing on the skills that we've learned to others who are also doing clinical trials. And of course, all these trials have to be compliant with all the local ethical and regulatory standards. Next slide, please. We have a well-developed lab that is able to meet all the local and international standards. We are fully accredited. And we also are enrolled into several quality management programs. Next slide, please. Next slide. Yes, and also as a lab, we are able to carry out many tests, several of them linked directly to clinical trials. So we are able to assess the safety of participants as they get before they receive product, as well as during the course of the trial and also after. So for some of the earlier clinical trials, we still continue to follow up those participants over the years, just to be sure that they remain safe and they remain okay. The next thing is immunology, which you could say is partly for research, but also to be able to tell that the vaccines that we've given are
Hello, Dr. Brenda. Dr. Brenda, we can't hear you. It seems we've lost Dr. Brenda. Yeah, let's give her a minute to join. As Dr. Edward Mberu prepares to give us his remarks, we've lost Dr. Brenda. Hopefully she'll join and we'll give her a chance to summarize. For now, I think we see what TDR has been able to achieve, as the two presenters have mentioned. And now I think it's a good time to hear from Dr. Edward Mberu, who is part of the team at WHO TDR that thinks through these initiatives and goes ahead to implement them. Dr. Edward, are you ready to give us your remarks? I'll stop sharing, and when Dr. Brenda comes back, we shall give her a chance to conclude. You have 8 minutes, Dr. Edward. Thank you very much.
Thank you, Freddie. I think, can you hear me?
Yes, please, loud and clear.
Thank you. I think I will take less than that because I'm not going to give any presentation. I'm just going to highlight some of the aspects that we consider pertinent to this kind of activities and the way forward. I think one thing that we need to talk about is to mention that this research capacity strengthening needs to be structured. A structured research capacity strengthening at the local level, be it at the national level or a district level. Of course, let's focus on the national level. There ought to be a structured research capacity strengthening that is locally supported, and especially so with a research agenda that it's been, taken through the national processes And therefore, when you have a research agenda, then you have this selling point that even with your collaborators, you are able to say, as a country, this is what are our priorities. So if you have to work with us, or if you need to work with us, this is where we need to focus. So most of the time is that collaborators come and they kind of take the show or lead the show because they form their own research agenda. There is no any other national guidance that they have to follow. And therefore, there is a very important role that national governments or national institutions have to come up and say, for us as a country or as an institution, this is what we'll focus. And therefore, the collaborators have no much option but to buy into that. Then there is also another aspect that needs to be considered, especially for research capacity strengthening, is that we need to have the research embedded within the system, within the programs. We have seen what our colleague from Mozambique highlighted. So now most of those activities, whether you are training healthcare workers or you are generating evidence, will happen if the systems, the health system is ignored, is not in the driving seat. So there is a deliberate requirement to embed the activities within the healthcare system. So if you are doing research capacity strengthening, you have to be careful or to be aware that who are you training and for what purpose? So if you are not talking and listening to the healthcare system, then you'll be doing your own things and finally they say, oh, okay, you have trained several PhDs, several masters, but we actually don't need those kind of skills mix. We need another set. So you have wasted like 5 years and that's gone, that's opportunity lost. So you need to therefore to have this like basic requirements, structured and locally relevant. And there's always a need when you're talking about locally relevant to identify the most appropriate key stakeholders. For health, of course, the Ministry of Health is the key one, but we have seen that we are also looking for one health approach. So you might be doing health very well, but the other aspects or the other sectors that contribute to the outcomes, you've ignored them. So one health is also an important part that needs to be considered. We have also the issue of individual versus institutions. There is capacity that you need to develop in individuals and also those that has to be developed or supported for institutions, because you can have PhD holders, master's holders, but the local research and environment does not augur well with their skills. So these two have to be a balance, that you're not only developing the research, the individual capacity, but also the institutional capacity. In creating awareness for opportunities is important, but also being able to articulate what are the requirements for those opportunities. At times we just put opportunities, but then they go out there and then nobody is aware that, oh, for this opportunity, the following are the requirements. And therefore it passes out, or the actual uptake of those opportunities is less because the actual requirements were not articulated adequately. I'm sure that, this is what Freddie mentioned at the beginning, this need for networking, and also add mentoring. This is something that is actually quite ignored in most settings, mentors and mentees. So there has to be pairs or twins that has to be put together so that we have people that can mentor the young ones. So if this is not properly articulated, then you will end up in some different, you'll have some less of the impact that you might need to have. You also need to have established community of practice. This is something that, it's ongoing, it's encouraged, but most of the time it doesn't seem to work well, but it's a good training practice that you can put into place, that people that have been trained, for example, Brenda can identify young, university graduates that are going into that area, and then you form a group that she mentors, she established a community of practice, and therefore her skills get multiplied. You have, as they say, you clone Brenda into several of them within Uganda, and that's what we are looking for. So and that's can only come if there is a deliberate attempt for networking, mentoring, and community of practice. Then, as we have seen during this COVID pandemic, that you need to have agile or adaptable platforms. So you need to continue to deliver the content, but also be careful that the quality and the quantity is what is expected. So it's not just delivering your online, virtual, blended, as they call it, or in place of face-to-face. This platform must also must deliver quality and quantity as expected. We also need to continuously expand the efforts that are already there. And how do we do that? TDR, as has been indicated earlier, is that it provides catalytic and galvanizing support. So TDR cannot take over from what the national government or institutions can do, but TDR provides some kind of a seed funding whereby individuals are supported, in some instances, the institutions are supported, and therefore those institutions are supposed to take over time and migrate from a project to a program, either funded locally by the governments or by their collaborators. And of course, as I don't, without any need to mention this, but it's important to note that TDR responsibility is global. So you can imagine how the pie is sliced into all countries, especially in those within the global south. So the funding.
Dr. Mbero, you have 1 minute to conclude.
Okay, and I think that's what I'm going to conclude with. So all we need is to continue training and ensure that research and training go hand in hand. So you cannot do research without training, neither can you do training without research. So they has to be paired and enable the development or the generation of evidence, generation and utilization of evidence where it is needed most. Therefore, embedding the activities, both training and research, within the healthcare system. And with that, I'll stop there and we'll be happy to contribute later. But thank you very much, and all the best to all the panelists and the attendees. Thank you, Freddie.
Yes, thank you very much, Dr. Edward. Again, if you're able to upload the presenters on your Zoom, please do. Otherwise, you can clap as a recognition for their efforts. Dr. Mbero, before I forget, I have 2 questions for you that you'll address later. The first is the scope and breadth of the initiatives at TDR in terms of if I'm a young researcher now looking for the opportunities, what is TDR currently offering, particularly for the countries that are represented here, Uganda, Mozambique, and Zimbabwe, and of course, where you are, Switzerland, and so on. The second is collaboration. From where you sit, what advice do you have about collaboration within institutions, particularly when they are looking for opportunities like those offered by TDR? A case in point, what do you usually get when several research teams in one institution, let's take a country, Wakanda, apply for the same opportunity that is available globally? What, as a person who reviews this, what advice? Is it advisable that research groups within departments in one university compete at global level, and so on and so forth? So we'll come back to that. Dr. Brenda is back. As I said, we'll give her a chance to summarize her presentation. Dr. Brenda, in 1 minute, would you like to summarize your presentation? And then I will present on behalf of Dr. Mutombo, who is not able to join, but has shared his slides. And then we'll have questions and answers, starting with Edward, the questions are presented, but also we have a number of questions in the Q&A. So Dr. Brenda, please, 1 minute to summarize your presentation, and then I'll take the participants through the slides of Dr. Mutombo.
Thank you so much for the opportunity, and I would kindly request that you actually go to my last slide, because I think that really gives the biggest summary of what I wanted to say. But basically, I wanted to highlight the different trainings that we have as an institution, both short and long term, and one of the clinical trials that currently we are busy with, which is the HPTN 084. And this second last slide is looking to future slides, which we are glad include COVID-19 as well. And we have also our president now very much eager to have local efforts to develop a local vaccine as well. So all those are actually in place right now, and we are participating in that. We are also excited about broadly neutralizing antibodies. Sorry, I think I have to get rid of one, but it was a backup. But even the backup of the backup failed last time. So anyway, this is what I wanted to highlight, the fact that we were able to, we are just preparing to do a study of broadly neutralizing antibodies for HIV. That's the C100 study. And then we are also very excited about being involved in COVID-19 COVID-19 vaccine trials. So there is one under Sanofi and one under FHI 360 that we are, both have already been submitted for regulatory review, and we wait for approvals. My last slide, please, which really summarizes everything. So it's really to thank all these different people, but especially TDR that is included there, because TDR actually contributed to my postgraduate training, but also that training on clinical trial development was really very key for me. And I'm very glad, it's good that Dr. Mbero, you had commented about mentoring. And mentoring is very key. And this quote by Isaac Newton, that I have been able to see further because of standing on the shoulders of giants. So my getting to this point has been because of mentorship. So I'm very eager to pay this forward by mentoring others. So the training that I went for in Belgium, one of our staff here at UVRI-IAVI is currently in Germany with the European Vaccine Initiative, where she's undergoing the same training for a full year. She's been one of our medical officers here and has been heavily involved in clinical trials. And now she's going to get mentored into different areas of management, as well as sourcing for funds and new partnerships. So that's something we are very excited about. The last thing I want to talk about is training for future capacity. And I want to invite all of you to look out for this clinical trials operation training, which is again sponsored by TDR, but also the Gates Foundation. And it's training that is available online, we hope in November, through a university in Ethiopia, but funded by TDR, funded by all those people that you saw there, and especially the Gates Foundation. So all of you who are involved in clinical trials, you have an opportunity to have your study coordinators trained on different aspects of clinical trial management right from your sites. They will have opportunity to engage with other researchers doing clinical trials within their country, but also outside their countries. I thank you very much.
Thank you very much, Dr. Brenda, for making that comeback. We are very pleased. I'll now take just 3 minutes to talk about one of the other presenters, and then we should end at 1:15. So I want to save time for Q&A so that we address some of the questions. Our presenter is Dr. Mtombo, who is based in DRC. He's also a beneficiary of the TDR initiative, and I'll just introduce him and some of the work that he has done. So he's currently a project coordinator, a senior clinical manager at the DNDI in DRC, and at that institution, he heads the research and development team. He led the team to monitor one of the clinical trials to assess the efficacy of fexinadazole administered to patients at all stages treated on an outpatient basis. He's a member of the commission which worked on the transformation of the third direction, which is a regulatory authority, into the organization ACOREP, which again focuses on regulation of pharmaceuticals, as you see the full name in French. And of course, it has more autonomy, more power, and hopefully better functioning. So in terms of his work, he benefited from the TDR Clinical Research and Development Fellowship. Again, one of the opportunities. I hope Edward will summarize for us all of them so that we have a clearer view. And his work is based on looking for treatments for trypanosomiasis, which is a neglected disease, human African trypanosomiasis, which, as we know, in our setting is neglected and still affects very many people in DRC, in parts of Uganda and other African countries. So with that, I will end this, and then we'll have sections. Of course, we express our gratitude to Dr. Mtombo for being so kind to share with us the slides. They'll be available as part of the World Health Summit report for all of us who may want to have additional engagement and who want to find out more information. So with that, I will now lay the ground for Q&A. And as I mentioned, we've had presentations from Dr. Teresa Eduarda from Mozambique. We've had a presentation from Dr. Brenda in Uganda, Dr. Brenda Okech, and then we've had Dr. Mberu, who is at WTDR. We have questions already. We'll start with Dr. Mberu. The two questions that I posed, please just take a few minutes to summarize for us. Thank you. Dr. Edward, please.
Thanks again, Freddie, for the opportunity. And I think I need to make a very brief summary that currently TDR provides support to 7 universities in the low and medium income countries in 5 regions, 5 of the 6 WHO regions. And these institutions provide master's program, and I think one does provide a PhD, but no longer a lot of funding for the PhD, but all of them provides master's focusing on implementation research. So most of them, of course, have their MPH, but then they have some kind of tweaking to ensure that the MPH they are providing has more emphasis on implementation research. So these are 6 universities, and I think I can list them. There is WITS in South Africa, Zambia, then Ghana. Those are 3 in Africa. Then we have 1 in South America, in Colombia. And then we have 1 in Bangladesh, and the other one in Indonesia. We don't have anyone in any of the universities in the WIPRO region, but so far, those are the 7 universities that provide masters for that has some relevance in implementation research. In addition to that, we also have 6 regional training centers, which have been emphasized here by our colleague from Mozambique. It's a satellite for the Ghana Regional Training Center. Regional training centers provide short-term courses that focus on good research practices. So it can range, as has been indicated, good research, good clinical and laboratory research training, other methodologies for research, including ethics, in implementation research. And currently the one in Ghana is running MOOC, the massive open online course on implementation research. We have also what I think Freddie has already maybe can also share is SORTID program. SORTID is short for Structured Operational Research and Training Initiative. This currently is focusing on antimicrobial resistance. Is a course going on at the moment for 3 African countries, Uganda, Ghana, and Sierra Leone. Of course, the other regions have similar courses. As I said, this is a global activity that TDI engages in. And then as what our colleague in DR Congo, Mutombo, and Brenda indicated, they participated in the Clinical Research and Development Fellowship. This is funded by Bill Gates. Is currently in its last phase, and then we'll see how this moves forward. But the other courses, the other activities are funded by co-funding by TDR, so these are likely to proceed for a long time. But the Clinical Research and Development Fellowship might come to an end, I mean, as it is at the moment by the funding from Bill and Melinda Gates Foundation. And I think I'll stop there.
Please. Mm-hmm.
And then the other question, I think you did indicate about what we do. Yeah. Well, this happens quite often. I have just had one case last week. We put it back if it's from, for example, from NIMRI, and then they have same but competing applications. We put it back to them and ask them to organize to put their house in order. Because sometimes they are talking about different study sites, different PIs, asking for the same kind of budget, but in the same institution. This we put back to them and ask them, we have received this from so and so, that we need to be more organized. They can still be separate, but there are some areas that needs to be harmonized so that you don't duplicate. And of course, you also need that they talk to the same language or the same area of work. If it's snake bites, then we need a more organized approach than an individual one. So I think this happens, but we get back to them and ask them to put their house in order. So I think I'll say that, and maybe if anything, then later, but thanks a lot.
Yes, thank you very much, Mbero. Basically, what I'm reading is that generally, if a university is applying for a grant, it's good that they go in as a single entity in harmony and with consistency. So before I forget, before 2 minutes, 1 minute before the end of the session, we shall ask all speakers to turn on their videos so that it can be captured. In the virtual world, we take screenshots now. Now I will invite one of the participants who has raised a question, but also he's not a beneficiary of TDR, but he can share some of the lessons learned in trying to build a research unit basing on basically what we've discussed. Dr. Patrick Budrico, you have 2 to 3 minutes to just summarize. We shall be cut off, so we need to really stick to our time. Dr. Patrick, please. Jasper, Dr. Nidoy, are you able to enable Dr. Patrick to speak? He's in the participants list.
Okay, let me look for him.
Patrick Budrico. Thank you very much. So as we do that, again, thank you very much, presenters, for sharing this. The other point where I will ask the panelists and participants to comment about is how some of the challenges have been addressed. Challenges when you return to your institutions after getting training abroad. Patrick, I think you're now able to speak. And hopefully you can turn on your video as well.
Thank you very much, Fred. I think I can turn the video from here. It's centrally controlled.
Please go ahead. You've muted yourself. Just go ahead and give your
Okay.
remarks.
I would like to thank you very much for giving me this opportunity. Rodrigo is my name. I am a founding manager of Research Center for Tropical Diseases and Vector Control in the College of Vets in Makerere. I also do appreciate the challenges that young African researchers do face. I, being a product of self-mentorship, I would like to add that in addition to what Dr. Edward has submitted, I think there is a lot that African universities need to do to give opportunities and platform for young researchers who go abroad to come back and settle. I think I started a lab in 2015, and one of the motivation is that upon going to Japan, I realized the high-end labs will just end where I went, and there is a high chance when I come back, there would be nowhere to start. So I started putting together a team of young researchers around me and laid down a vision. I'm happy to note that if you persist and also use networks that you have to gain into support systems, it is easy to make it as a young researcher. And so we have to encourage peer-to-peer mentorship amongst young faculty together with providing platforms for mentorship by the senior, as Dr. Edward said. But also I believe there is need to build what we call research tenure system in our universities, because it's not enough to have a lecturer have much of his workload in teaching and then hoping he won't be able to innovate. I have seen over time that it doesn't work. Too much workload in a class will take away your space for thinking, creativity, and innovation. But out there, other universities develop parallel tenure system for researchers, and they are only given 15% of their time to teach and share experience. That will allow mentorship of graduate students, but also retaining them and getting opportunities for them to continue to work with you in your team. I also noted that...
Dr. Patrick, you have 1 minute.
Okay, thank you, Fred. The other aspect that we need to think about is the reward system. Well, there are all these young people who are trying in a very limited space, and what support system does our institution build to be able to nurture their vision and their dream to be able to inspire the others? And in a further discussion, I think I would wish at one time to meet Dr. Edward to have a little more discussion with him, Fred, if you can link me to him. Thank you very much. And since we don't have much time, over to you, Fred.
Yes, thank you very much, Dr. Patrick Rodrigo. This one of the main aims of this health summit is to network and collaborate and continue the discussion with the aim of improving our approach to addressing health challenges. Right now, we are all faced by the COVID-19 pandemic, but we know if we are to achieve the Sustainable Development Goals by 2030, I remember we set them 10 years ago. We've 20 years ago in 2000. We are now third way. Yeah, so we've basically used up 20 of the years. When we look at our dashboard, how are we doing as countries? Teresa summarized for us how the TDR funded program is addressing that in Mozambique. Brenda showed what UVRI is doing. Dr. Patrick has shared. As we leave this session, we need to ask ourselves, how are we moved towards achieving the Sustainable Development Goals with the capacity initiatives that TDR has put in place, but also with the other opportunities that we've received. I'll now use 1 minute to summarize before the host of the session can take over. And there are basically three things. One of the things I noted, for instance, from the presentation from Dr. Teresa, was that language is important. So, for instance, she emphasized that they looked to build capacity of Portuguese-speaking institutions and countries. And then eventually, they cross-pollinated their experiences and learnings with Francophone and Anglophone, and she showed us very good numbers there. The other point was about collaborations. The third point was about networking and communities of practice. As I mentioned, the session will automatically turn off at 1:15, so we really have to finish that. So I will not give I don't think we have time for panelists to make any comments, but then I'm again very grateful. Thank you to the panelists. Over to you, Jasper. You have less than a minute for any logistical administrative issues. Dr. Nidoi, please.
Yes, I'd just like to thank all of our panelists and attendees who have joined us in this session.